Oh my.
Good evening, everyone, and welcome to the Parsha Buzz program where Jewish learning and business meet. I'm Rabbi Lichtenstein, director of the Columbus Community Kollel, and it's my honor to welcome all of you to a very special program. And there's going to be a little bit of a focus on our health this evening in both segments of the program, of the Parsha segment and then the second segment. But before we get into that, I need to first share with you, this past Sunday, I was at an incredible rally at the Gesher Center, which, unfortunately, I never had the opportunity to meet the one who put it together. His name was Murray Ebner of blessed memory, but I've heard much about Murray, and he was very effective and instrumental in a lot of Holocaust education. His son Mark and I and Lisa and Cindy were, close with, but I never got a chance to meet Murray. But he was very instrumental in getting this, the Gesher set up. And there was this incredible rally for Israel. And you had Jews, you had Christians, and even within Jews and Christians, you had a very nice, diverse group and affiliations. You had Reform, Conservative, Orthodox, rabbis, laymen, ministers. You really had an incredible group all coming together, putting aside maybe some other differences, but rallying behind a very strong shared value. And we had these, so at the Kollel we do these lunch and learns with some of our Bexley teens, and this week we're having this discussion. Why is that important? Why is it that we need to gather together in Columbus, Ohio? How does that change things thousands of miles away? What is helped by us doing what we're doing here? Is it because we're giving each other support? Is it that perhaps they get more military aid? What's exactly behind this? So I want to let everybody know about a very interesting concept, and it's called, and I'll say it in Hebrew and I'll translate it. There's something called nosim ba'ol im chavero, which means to help carry the burden of your friend when they're going through something, to share the burden, to sort of, share the pain and kind of like be part of that load, helping them carry through. And I heard an incredible, a beautiful thought that helps explain how this works on a spiritual and I guess even emotional level. So I have a friend in New York. His name is David Lichtenstein, for those who are on our program 3 weeks ago. You may have seen him. He's an incredible individual. He's the CEO, founder of the Lichtenstein Group. And he said over his story how he acquired Birthright from Michael Steinhardt. Great story if you want. It's on our YouTube channel if you want to watch that. And he once shared in a different talk the following concept on how we can understand this idea of sharing the pain of other people. And being that he's a real estate developer, his example was something special. So imagine you're trying to build this major buildings, several stories, and the thing that you're working on, of course, the first thing is the foundation of the building. So he said over when he was building this building, he had some people come over and give him different quotes, and he was asking what the constructor, different types of tiles and different things they were looking at to fill the surface of the foundational floor. And he asked the contractor, so how much weight can this tile bear? How much weight can this tile take without it cracking? And he said whatever number, I don't remember, but he said whatever number, however much weight it was. And they started to, think about it, math, this, that, whatever. And then he said, but 1 second. But when you think about everything, all the stories, all the floors and people, and, all the walking and everything that's going to be going on, I'm not sure if that's going to be able to, stay together. And he said, oh, no. When I said this is how much weight it could take, that's when you have a single tile. But if you have all the tiles next to one another, and they're glued or cemented or however they get them to stick, and they're next to one another, and they're in place, they're not moving, and it's like one extended tile, so the weight gets dispersed, and therefore it could take much, much more weight. And that, I believe, is the explanation behind sharing the pain and the burden of other people. Nosim ba'ol im chavero. That if we're just one tile, if we're just one thing, if we're just isolated by ourselves, right, then it gets, we're limited in terms of how much weight that we could do. But if we stand together, arms beside one another, and we embrace each other around things that we share in common, although we may have differences in other areas, which is fine. But we share a common thing so that there's that glue on each side of us that connects us to everybody. So then we could take much, much more weight. And sometimes when people are, going through whatever it is that they're going through, imagine, someone going through suffering, right? Sometimes they don't want to hear, oh, I know what you feel like, because no one knows what they feel like. No one is that person having this situation, this time, and this place with everything else going on. Everyone's unique. But what people would appreciate is just knowing that you're there, knowing that you're beside them, your thoughts are with them, your prayers are for them, and therefore the person in his mind feels like some of that was lifted up, some of that was taken off. The load is not as heavy because to my right and to my left, some of the weight shifted. And that is what we believe in Nosim ba'ol im chavero when we share the pain and the burden. So, when we talk about getting together in solidarity, it's not just symbolic. It's not just, it's an activity and we get some rallies and there were some great discussions and there were some great speeches. I'm blanking on the name of the pastor that spoke. He spoke amazing. It was incredible. He had great lines. Some of them I would want to use myself, but I have to give it some time. Otherwise, everyone's going to know where it's from. And then Rabbi Goldstein from Congregation Beth Jacob, and then president of the board of rabbis spoke, and incredible. But it's not just symbolic. It's because we're taking some of that weight and we're making the burden easier for our brothers and sisters. And of course, it's not just with Israel. It's whatever circumstance that we're in, whenever we have a friend, a neighbor, or anyone in our family that's going through something, just letting them know, I may not be able to appreciate fully what you're going through, but I'm here for you. I'm sharing your pain. I'm keeping you in mind. That fact, that itself kind of takes off a little bit of the burden. And continuing in this theme about joining our brothers and sisters, joining, keeping this unity, so that takes us to this week's Torah portion, which is Parshas Bahalosecha. And for those who are following us inside, it's on page 794 and 795 respectively. And if you don't have a Chumash, we have a few left of complimentary to you to follow along with us. So there's a great story, has a little bit of a consequential ending to it, but nevertheless a great story of Moshe Rabbeinu, Moses, our leader, Moses, and his sister Miriam, talking about Moshe, I should say, Miriam talking about Moshe to Miriam, her brother Aharon, Aaron the priest. And they had some sort of discussion and conversation and a complaint about Moshe. They had a complaint about Moses. Now, what was their complaint? So Rashi tells us, because Moses just received the Torah, he just received the Bible on Mount Sinai. And because of the obligations and time constraints and the commitment to the Jewish people being God's person, Moshe was not able to spend the amount of time that a regular husband would be able to spend with his family, specifically with his wife, and they, quite frankly, didn't see each other that much. And Miriam was not happy about the fact that Moses was not around his wife, by the way, Moses' wife was Tzipporah. And they had this complaint. So Miriam complained to Aharon, to Aaron, about Moshe. And then after, the conversation, Hashem, the Almighty, expressed his concern that they should not have been discussing such matters like this about Moshe to Aaron. And Miriam was afflicted with tzara'as. Tzara'as in Hebrew means leprosy. And, leprosy is not really the best translation, but it's kind of like what we have in English. And she was afflicted, and it was a punishment for her speaking what we call in Hebrew lashon hara. What's a good English translation for lashon hara? For gossip, not such good talk about one another, about other people. And she was afflicted, she was punished. And Rashi explains all of this that was going on. Rashi explains because she was punished because she spoke, she violated and transgressed this prohibition of speaking lashon hara, of speaking not properly about a fellow person. And of course, the reason why it was considered lashon hara, the reason why it was considered deceitful talk, is because if Miriam had a problem about Moshe not being with his family, she could have gone straight to Moshe. But the mere fact that she had to talk to someone else about him and start talking, right? You know what happens when you start talking to one person, right? News travels fast. So they say, if you want something to keep, to stay a secret, don't tell anyone. That's part A. Part B, if you want to make sure that something gets out, you say to someone, I'm telling you this in confidence, okay? Then you know it's going to go fast, right? Jokes aside, why did Miriam have to go to Aaron to talk about someone else? Why couldn't she go to Moshe? Now, by the way, there are times and there are exceptions where one is allowed to speak lashon hara, where one is maybe even obligated to speak gossip about someone else if they're doing it to protect someone from something dangerous or getting cheated or stolen. It's quite, there are a lot of details that go into that. In fact, there's an entire book, which I have right next to me on purpose, that's the Chafetz Chaim, a daily companion, a laws to proper speech, that go through all the times where one is not allowed to speak gossip about other people, and when one is allowed, and when one is even perhaps obligated to. But this was not a time, this was not an example where she was supposed to be talking about someone else, partially because she could have gone directly to Moshe herself. And we say something every single Shabbat in the prayers, and it comes from King David, Psalm from King David, and it goes as follows, and I'm going to say it in Hebrew and translate as we go along. And some of you might know this to a tune, some of you just might know the words, and if you don't, it's a great writing by King David. And the words are thousands of years old, but it rings as true as ever, which is, of course, why we're so committed to our text, because of how relevant, old yet relevant they are today. King David said, Mi ha'ish hachafetz chaim. Who is the man that wants life? And he answers, Nitzor lishon chamera, someone who guards themselves from speaking, lishon chamera, from having a bad tongue, which means to speak evil. Usfasecha medaber mirma, and from their lips speaking evil. Sor meira, turn away from evil. Va'ase tov, and do good. Bake shalom v'rodfeu, and seek peace and pursue it. If you heard that phrase before, seek peace and pursue it, it comes from King David, Bake shalom v'rodfeu. And think about what he's saying. King David is saying, Mi ha'ish hachafetz chaim. Who is the man that wants life? Didn't say someone who wants to have a nice little reward, a pat on the back. No, someone who wants to be healthy, someone who wants to have life. Someone who wants to have life. His promise, his way forward to health and life is to not speak lashon hara, to not speak evil about other people. And if we were to think about this, perhaps as I think most of us are parents, imagine if we heard our kids talking about their siblings negatively when they thought we weren't listening. How much that hurts the parents. Now, if it's just, 3-year-olds and 4-year-olds and 5-year-olds, okay, fine. I've got a 4-year-old at home and it's fine. It wouldn't bother me that much. as long as he goes to sleep on time. But as they get older, and they're, you're not dealing with 5-year-olds, you're dealing with 20-year-olds and 30-year-olds, and the parents are just a couple years older, of course, still young. But the parents are overhearing their 20-year-olds talk negatively about their fellow siblings. How does that feel to the parents? The pain, the anguish that the parents feel. And really, Hashem, our Father in heaven, God Almighty, it's really the same thing. Because we're supposed to be arm in arm with one another. We're supposed to be that one tile that when we're together, we will be able to take any weight, any burden, because it gets dispersed. That's the way we're supposed to be. Yet when the Almighty hears us not like that, perhaps, and we're judging people, and we're perhaps not saying the nicest things about one another, what's really happening? The father's hearing his children talk negatively. It hurts. It's painful. It's very painful. And I want to conclude this thought with maybe a selfish aspect to it. I always say that if God wants us to do something, a mitzvah, a commandment, a good deed, whatever he obligates us to do in the Torah, in the Bible, obviously it must be for our good. There's no way that our Father in heaven would ever ask us to do something that's not for our good. So by virtue of it being a commandment means that it has to have some, what I call, selfish and personal benefit. So let me explain. There are 2 ways a person could feel good about themselves, in my opinion. One way is specifically in contrast to someone else, someone specific. One way is to recognize he has strengths and you have strengths, and you know your strengths. You may know your weaknesses too, but you know your strengths and you're good with your strengths. You own up to your weaknesses and you deal with it however you deal with it. But you know your strengths and you appreciate them, and you know how to not just you know them, you know how to utilize them, and you follow through and utilize them, right? I always say self-esteem is 2 steps: knowing the worth and then actually putting it to use, right? Different talk for a different time. But that's one way to feel good about oneself. Another way is you bash other people around you. Because if the person's here and he sees someone else here, he could either raise his own esteem or he could slap this one down. And that's kind of what we do when we, unfortunately, myself included, we all struggle with this, when we speak Lashon Hara. So of course, we should not want to speak Lashon Hara. We learned from Miriam, of course, we don't want to speak Lashon Hara because it's what Hashem does not want us to do, and we should do it for that alone. But if we were to talk selfish for a second, if we were to just be like, what's in it for me? Where's the skin in the game for me? Well, number 1, David HaMelech, King David, promises you life. And two, your own self-worth will go up because you don't need to knock other people down. Your own esteem, your own self-esteem is just good enough. I don't need to do that. I don't need to talk bad about other people. And perhaps with these things in mind, we could learn from Miriam's mistake. Of course, when we talk about mistakes of people in the Torah, we don't really understand them because they were on such a high level. We're not really there, but on their super high level, we could learn from that. And I'll also end with, I do find it very interesting. And you might find this funny, and I do too. The one example the Bible wanted to single out when it comes to Lashon Hara, when it comes to speaking gossip, is a case about family. Someone speaking about a sibling. Someone speaking about someone in the family, because we like to think, it's family. Come on, it's all, it's good, right? That's how we think, at least from what I've heard, right? But I think the Almighty's teaching us a lesson. No, we're all family. It doesn't matter. Everyone's family. Everyone's, why? Because we're his children. God wants us all to be treating each other like siblings. So whether it's Moshe, Aaron, and Miriam, Moses, Aaron, and Miriam, or it's you and me and everyone on the Zoom call and all the people that will be watching the recording. Thank God a lot of people watch the recording on the YouTube channel. So all those who are going to be watching this recording, treat them like they're your sibling and your parents are listening, right? There's no feeling like you thought no one was listening and then you realize, oh my gosh, right? It's like you reply all when you meant to reply to one person. Oh no, they're going to see that, right? It hurts, right? So pretend that that's always the case. Someone's always listening. Someone's always watching. And perhaps when we remind ourselves of these concepts, we will treat one another with respect. We will talk positively about one another. And if we must, to protect and for the right reason, have to speak negatively, we do it not because we're excited to do it, not because we need to put them in their place, but because I need to help the person so he doesn't get endangered by that person. And if we do that, like King David said, we will be healthy. We will have life. We will have our health. And with that, let's go to part 2 of our program. And it's very exciting, especially as we have, I see on the call, we have a good few number of doctors, some very accomplished doctors, and I see David Portman and Laura Blumberg, and who else do we have? Phil and Julie Wienerman. If I'm forgetting anyone, please forgive me. So we're very privileged to have our guest speaker tonight, someone who in not such a long time really created an excellent reputation for himself. Our rabbis teach us that there are a few things that you have that are really yours. The money that you have is here today, can be gone tomorrow. Your possessions, your assets, they could just, but someone's name, someone's reputation, someone's legacy, what they stand for, that could be eternal. And so we're very excited to have someone who's brought a tremendous amount of leadership and a sense of care and a sense of responsibility when it comes to health, specifically over the last, 14, 15, 16 months, the roller coaster that we've all been on together. And thankfully that's, starting to, thank God. So with that in mind, I want everyone to, if you can, please to keep your cameras on or turn them on. If you can, that would be very much appreciated. If not, okay. But nevertheless, everyone, please join me in welcoming our guest speaker this evening that we are featuring for our fireside chat, Dr. Stephen Markovich, the CEO of Ohio Health, someone who I've heard the most amazing things about from different friends of mine. And Dr. Markovich, thank you so much for joining. We are thrilled to have you on our program.
Rabbi Kappenstein, thank you. It's a pleasure to be here. Excuse me. Is that Phil Wienerman from Riverside I see in the middle of my screen?
Sure.
Good to see you. It's been a while. It's a pleasure. And I see some other folks I've met across the years. Thanks for the invitation. Rabbi Kappenstein reached out and asked if I would speak, and we set up a time to talk, and I thought, thinking it would be 15 or 20 minutes of a quick chat. I think we went for over an hour. We went down 100 rabbit holes on things to talk about. So it is a pleasure to be here.
Thank you. Likewise. So, Dr. Markovich, if you could let our audience know a little bit about yourself. Where did you grow up? Your education, maybe some hobbies. Can you give us a little bit of your background?
Sure. Steve Markovich, originally born and raised in suburban Detroit. Grew up in a place called Farmington Hills. Went to the University of Michigan as an undergrad in biomedical engineering. As a younger person, I grew up in the space race era. It was the 60s, rockets, airplanes, fighter pilots, test pilots, things like that. So I always had a fascination with airplanes, and my mom was a nurse, and I got this bug at a young age that said I wanted to be a fighter pilot, I want to be a doctor. And so went to Michigan and then joined the Air Force and spent a number of years in the Air Force flying, and then left the active duty Air Force to go to medical school at Ohio State. At that time I was living in Ohio, and it made sense. So I went to medical school at Ohio State, residency in family medicine at Riverside here in Columbus. I stayed in the military. I jumped from the active duty military to the National Guard, and what was supposed to be a relatively short experience turned out to be a 38-year career in the military. But I continued. So I had these two careers going at the same time, where I was a member of the military and then a family physician at Riverside. I worked in the ER. I took care of a couple of high school football teams, taught residents, rounded in the hospital. And over time, one thing led to another, led to another, led to another. I was fortunate to be asked to take some administrative roles. I ended up the president of Riverside, and ultimately, about 2 years ago, promoted to the CEO of Ohio Health. That's a long career in about 2.5 minutes.
Wow. No, I love that. So when did you feel like, okay, medicine, that's it for me? Like, was there a single, an incident, a story? Was it something that you always had in you? When did that decision kind of, get made for you?
I mean, I don't know that there was a moment. Like I said, my mom was a nurse. I'm the first person in my family to go to college. So the idea of education was, my grandparents immigrated from Croatia in the turn of the last century. And we lived a very modest life, and it was very education. I was brought up in a world that said education is a big part of what you need to, where you need to go. And it just seemed to me, medicine made great sense. It seemed that my mom had a very enjoyable and rewarding career. She would, people respected her, and at Christmas time she'd come home with baskets from patients, things like that, and grateful patients. And it just seemed like a very rewarding thing where you got to use your mind and you got to give back to the community, and it all made sense.
Great. Nice. So now I want to know how from, medicine to Ohio Health, and then within Ohio Health, how did you get to the CEO? What was that journey like?
Well, not planned. I mean, if you roll the clock back 25 years or so, I thought I was going to teach residents and work in the ER a little bit, and have a practice somewhere, with, have 3 partners and have a practice and have a life. And I still have a life. I didn't mean that in a bad way. But what happened literally was, and when I talk to young residents, and we have administrative fellows, people that are working on their MBAs that round with us, I got tapped on the shoulder. I haven't really interviewed for a job in the last 20 years. What happens is people tap you on the shoulder and they say, we have a problem over here. We think you might be able to help us fix it. Will you come over here and help fix it? And so you go and you work on that for a while, and all of a sudden that thing turns into a job. And then somebody else taps you, and you say, okay, I'll help. And so I try to instill in some of the folks I work with, the younger residents and fellows, that life isn't, it may not look like a straight line career. It may look more like a jungle gym of things that may or may not connect the way you might normally think they're connected. But that the doors will open and they will ask you to go through them. And you don't have to go through them all, but you should consider it. It may not be the door you thought was going to open, but sometimes when you go through it, it can be tremendously rewarding. So having spent a significant amount of, as a physician, I'm the first CEO that's a physician that Ohio Health has had. All before me, it's always been more traditional business types. And so as I was moving up at Riverside, and then I was responsible for a lot of the operations in Central Ohio, and ultimately the CEO job, I came up as an operator. I came up, running hospitals, running practices, kind of very much involved in the day-to-day. And so it gives you a great appreciation for what it takes. There's 35,000 people work at Ohio Health, and there's every day it's a tremendous machine taking care of a lot of folks. Once you get to understand how that all works and how it fits together, it gives you great insight on how to move things and improve things. But then you partner with team members. You've got physicians that you work with, or you've got other administrative folks that you work with. If you can create a common vision for what you're trying to accomplish, I think that's probably one of the things that got me to where I am, is that ability to articulate and connect with the people that I work with and get them excited about what it is we're here to do. But the biggest thing is you can't be afraid to go through doors.
Nice. So you have 35,000 people under you at Ohio Health, one of whom is on this call tonight. I'll give a shout out to my fellow softball team member, Shimon Berger, who's on the Zoom tonight.
I'm still in my jersey. I won't go video on.
Yeah. So I also had my jersey on, but I quickly changed for the program. But we just won, so congratulations. But in any event, so you have 35,000 people working for you.
Right.
That's quite a responsibility. How do you deal with that?
Well, um, I mean, clearly it's a big job, but you don't do anything at this level without a great team and with literally dozens and hundreds of people that work for you and with you. Uh, I mean, on a more personal level, you try to keep things in perspective. You try to take care of yourself. I am not. Trust me. I'm not. One of my colleagues is. I can see on the line. She would know. I am not perfect as I drink my Diet Mountain Dew this evening. Um, you try to enjoy it. You try to get some exercise. You try to get some sleep. You stay focused on the work, and every day try to make the place a little better than it was yesterday. Um, if you love what you do, if you really are excited to come to work every day, and you get, whether you're working on a problem or you're working, there's so many things to get excited about that are fun and they're stimulating. And when you put it in the context of we have great healthcare in Columbus. I mean, I hope everyone knows how fortunate Columbus, Ohio is. And I can talk about that, but to be part of a healthcare environment that delivers great high quality care, works with some tremendous people, and really is really a benchmark for the country. To be part of that, it's easy.
I love what you say that, if you love what you do. So I happen to be a big fan of, I don't know if everyone has heard of him, but his name is Simon Sinek. Yep. And he's a guy who I love his stuff. I've watched his TED Talks dozens of times. Like, I can't hear him enough. And he defined passion as follows: you get up and go to work, and you love it so much you can't believe you get paid to do it.
That's right.
And that's his definition of passion.
Right.
So you mentioned about how fortunate we are here in Central Ohio, and not too far the Cleveland Clinic, but specifically in Columbus, I understand that you have a really nice working relationship outside Ohio Health. I wonder if you could talk about two things in this question. Number one, why are we so lucky? What are the things that make healthcare so good in Columbus, Ohio Health, and even outside Ohio Health? And B, healthcare can be competitive. How do you, what are the things that you do to keep a working relationship with people that might be on some level competitors?
Well, it starts, and some people on the phone may be familiar with this and others may not. It largely goes back to Les Wexner and a few other folks that years and years ago created a relationship between a number of the big entities in town. We call it the partnership. But you've got most of the CEOs of the largest 50 or so companies in Columbus come together all the time. And one of the things, and I'm relatively new, having only been a CEO for 2 years, but there is an air of civility. There is an air of focusing on making the community a better place for all of us. Despite the fact that in some cases we may compete, there is still the expectation that when push comes to shove, we will do the right thing for the community. So as it relates to healthcare, you've got 3 adult systems and children's hospital in Columbus. The Columbus Nationwide Children's, one of the finest, top 10 children's hospitals in the country. You've got 3 large institutions between the Mount Carmel system, Ohio State, and Ohio Health. We're fortunate in Ohio Health. It doesn't matter how you slice it or dice it, whether you look at admissions or discharges or patients served or tests or dollars. We do about half the business, and Ohio State and Mount Carmel do about 25% each. If you go into any of our hospitals today, any of you, if you walk in with a heart attack, if you walk in with a swollen leg, if you walk in with a stomach problem, regardless of your ability to pay, we will do whatever you need to take care of you. If you need open heart, if you need anything that any of us do, there is no county hospital in Columbus where the indigent go. There is no county tax that's levied on the citizens to take care of folks that are less fortunate. The healthcare system has come together and said, listen, we're going to make it work. Whatever you need, we'll take care of it. So we do compete, but at the same time, when you talk about things like gun violence, infant mortality, opioid epidemic, the CEOs all come together and we say, how can we best solve these problems? These are community problems, social equity, violence, there are tremendous issues there are drivers of poor health that affect our country, at a national level. We try to work on those together to really have a common front. So when I say Columbus is a great place for healthcare, the quality is very, very high. The resources are very, very deep. I'm the first to say at Ohio Health, we don't do kids. We say Ohio Health or Ohio Nationwide can do that. We don't do transplants and burns. We have Ohio State is a very high quality center for some of the really high end stuff. Ohio Health is what I would call a high end community based hospital system. So pretty much everything besides burns, transplants, and kids we do, and we all do it at a very high level with research and training and teaching. And the beauty of that is that the people of the community benefit from that. And that competition actually drives a better product. We all measure everything that we do. And every year, the fact that we're trying to outdo each other a little bit actually creates a better environment for the folks that are on the call.
I love that. I think you nailed it with, at the end of the day, it's community. And,
right.
That you don't lose sight of that. I love that. That's really.
Sometimes we call it co-opetition. We cooperate, we compete,
I might use that with some of my colleagues here. Okay, good. I don't know if there are any rabbis on here, but they will get a recording of that. Okay, so I want to ask you one last question, then we might go to like part 2 of this second segment. And that is there a part of medicine that maybe interests you or fascinates you more than other? I mean, like you could just focus on the brain and how incredible the greatest computer ever invented is that's in our head, or the eyes, or the heart, and so many, different organs. Is there a part of medicine that just like, wow, just like fascinates you more than anything else?
Well, at a certain level, and for I know we've got probably some physicians and other healthcare folks on the phone. I mean, just anatomy in general. If you've ever had the chance to study anatomy, to go to the operating room, the body is the most wonderful machine that is so intricately put together. If you don't, if you don't believe that there was some divine intervention in the creation of this machine that functions at such an exquisite level, it really does fascinate me, because if you think about it, it's taken us thousands and thousands of years to start to create robots that still can't do what we do intuitively. You know what I mean? Just to create a machine that can balance and stand. I mean, and here you are, a 1-year-old pulls themselves up and they start to walk. So it's the human as an organism is an amazing thing. If you think about maybe a specialty that interests me the most, I mean, I'm a family physician, so I did 3 years after medical school in family medicine, and I still believe that and maybe this isn't a specialty or an organ as much as it is the relationship that people have with their physician. I grew up in the Apollo era. For those of you that are my age, I grew up in the Marcus Welby era. For those of you who may know who Marcus Welby was, it was a TV show back then. And it was all about this relationship between the physician and the family, or the relationship between the patient and the doctor. And as much as we may need to move to artificial intelligence, and we may need to move to televisits and video consults, and my wife had poison ivy and she's on a Zoom call with a doc showing her rash to the doc through the camera. As much as we move to that, for the really, really important parts of life, I think we still want to go back to having somebody sit inside of your bed and tell you what's wrong with you, or that you're going to live, or that you're going to die, or that you're going to have a baby. I don't think we will ever get to the point where that can be automated away. And I think that's the part of medicine that still fascinates me.
Beautiful. No, that's right. Relationships 101.
Yeah.
So I hope everyone's okay if I bring this up, but COVID. So
I'm done.
Yeah. I guess my first question is when, oh wow, 36th year. Congratulations, Sandy. Incredible. For many more, as we say until 120 in good health. So I want to ask you, when did you know this thing was big? Everyone's got their own marker. Some say mid-March. Some say I was starting to feel it in February. When did you feel like, that moment?
Well, we started looking at it right around December because you were starting to get some of the news flashes coming through the CDC coming out of China. But I think the place where it really rocked me, I can't speak for my team, but if you think back to the things you would see on TV coming out of New York, and when you saw the pine caskets being buried, in mass graves, which is the kind of thing this country is just never experienced. This is unheard of, that we wouldn't have the capacity in the United States, let alone in one of the largest, most advanced cities in the country, like New York City, to be able to handle whatever's going on. And at that point, we were like, holy cow, this is going to be a much more complicated problem. And you start to think about federal resources, state resources, community interaction, PPE already, with the idea, the masks and the gloves and the gowns was already a hot item. So I'd say it was in that first quarter, the first 3 months of last calendar year, that it became very, very real. For me, less so off of what I was reading in the journals or in the news flashes as to what we were seeing on TV. When I saw nurses wearing trash bags, they had black big trash bags on for PPE, I said, we got a problem.
Wow. And tell us how you pivoted, like after okay, we got a problem. So then what was, the next morning, how did you guys take action? How did you transition or pivot after that?
Well, you first and foremost, and I think I mentioned before, I spent 38 years in the Air Force. You don't tackle big problems without people. The people will get you. The people will accomplish the mission. And I said this over and over across the years. You have to take care of the people in order to take care of the mission. So we rallied the team, and I took a position with my senior team. So I have an entire team of senior vice presidents that work with me. But we had a conversation. We said, listen, this is not the kind of a thing that executives in the ivory tower of some office building, this is not a fight we can fight. This is going to have to happen much closer to the front lines. So we need to create a structure that's led largely by what I would call mid-level management, the people that are at Riverside or at Dublin or at Grant or in the doctor's offices to create the teams to deal with this. You do have to divide the work up, whether it's protective equipment or clinical processes or resources or staffing. Should we put all the COVID patients in one hospital? Should we take the COVID patients and spread them out over multiple hospitals? They have to work through this process. But for me, it was more important that those folks knew that we were there to support them, break down barriers, and get them resources. And it was not our job to swoop in and drive the day-to-day leadership. And so we literally, we asked people to be right on the front lines, and then some of us stayed back and said, it's really hard. It's really hard not to swoop and to judge and to want to get in there and say, hey, I can do it better, or I've got a better solution. You've got to let people do it. So we organized around the people, organized around the problem, get the hell out of the way of the people that have to make the decisions, and support them. When they make a mistake, if they make it, you're only going to have 80% of the data ever to make a good decision. So we know they're going to make some mistakes. We know they're going to have to correct. Don't judge, just keep pushing forward.
Okay, so now that you sounds like you accomplished it at a very grassroots level. So that's a little hard. Sometimes it's hard for people to let go.
Yeah.
Was that hard for you to kind of like not be the one that's like trying to grab it by the horn?
Yeah, it's naturally I like to jump in. I think too, there's a lot of folks there's a saying in healthcare. Same thing for policemen or firemen. There are people that run towards the sirens, and there are people that don't run towards sirens. Healthcare folks, especially people that work in ERs, things like that, it's like that old saying, put me in, coach, I'm ready to play. People want to be involved. So you have to actively stay above the fray. Now, that's not to say, and again, I'm looking at some of the folks on the TV that are on the screen today that I know. That's not to say that I didn't ask a lot of questions as to how things are going, or just to, to make sure that the people on the front line, that their thought processes were clear. But it was really about trust. It was really about saying, okay, I got your back. And I said that in a big video one day. I said, you guys are going to be out there. Whatever you need to do, do it. I got your back. And I had more feedback on that one line. I had two lines that I got a lot of feedback on. One was, I got your back, and the other one was, we got this. And just, it was kind of a sense of pride, a sense of support, and that really allowed people the freedom to be active in the process.
Amazing. I kind of wonder, that we believe that something called hashgacha pratis, which means divine providence, how God has a way to set everything up, putting people in the right place, the right time, and He put you in this place and this time after your service in the military, where sometimes you got to make quick, tough decisions and know when to jump in and when to jump out, and then only a year or two into Ohio Health, you're the one who's leading this. So I just kind of see that the juxtaposition within your career as something very interesting.
You're very kind, but it was a lot of people, and not just for Ohio Health. I mean, really, I got on the phone with the other CEO. We had a phone call right at the beginning with the 4 CEOs, and like we said, we compete, and we have some pretty big egos sometimes, and we all agreed. I remember one of us saying, we got to check our egos at the door. This is the one time for the good of Columbus, and we got to check our egos, and just whatever we need to do, we do. You may have heard we had 1,000-bed hospital set up at the Columbus Convention Center. We did that essentially with no government intervention. The hospitals got together and we just did it on our own with a lease from the Franklin County Commissioners. So that kind of cooperation is really important when the chips are down.
Are there any stories of some great work from anyone in the staff, maybe some boots on the grounds that you could share with us? Like selflessness of someone, just, the care and the dedication that you could share with us?
I mean, I could tell you 100 stories. We had seniors, husband, wife with COVID that it was clear they were going to pass, and the nurses would put them in the same room so that they could pass together. They spent, the kind of thing where the couple's been married for 70 years. And who wants to have them separated at the end of their lives? We had an obtunded woman with COVID who gave birth to a healthy baby, and so the mom came in, got sick. She had COVID. She got very, very ill, but she wasn't at term, so they kept her going until the baby got to the point where they could deliver the baby. Tremendous stories of sacrifice from the staff, where people, we're in the healthcare business. I mean, people come to us, and I think we do a great job of caring for them, but people do pass, people do die when they're in our facilities sometimes. The rate of death was 5-6 times the normal deaths per week. And so you had nurses and caregivers and chaplains and taking care of patients where they would take care of a patient, they would die. Take care of a patient, they would die. Take care of a patient, they would die. And there were no good stories. That it was just this emotional drain on these frontline nurses and staff. And to see this, sometimes they would just go outside and they'd cry. And the emotional toll that the team took was tremendous during this, because at that time, you have to remember, March, June, we had our first peak, then things got quiet in the summer, and then our highest peak, we were actually 3 times as many COVID patients in December, like 5 months ago, than there was last year. So there was this big, when's it going to end? When's it going to end? When's it going to end? Because the duration, a lot of us can do a lot of things once or twice. You can suck it up and you can get through it. But we were asking people to do things for months, if not a year, and they just so just the resiliency of the team, it continues to take my breath away.
Wow. So that brings me to the next question, which is mental health. That's a big one. It's kind of the other side of the COVID coin. both in terms of people that are not sick, maybe of course not as much, not sick, but then they have to deal with the isolation and quarantine and all of that, not going to school like they used to, et cetera. And they're not having the social life, which also has its, consequences. And then the people that are, in your case, dealing with a couple that has to die together and you're going outside of the room to cry for a little bit. How did you make sure that their mental health was, at peak performance?
It's a great question, probably the most important question. My team made 3 commitments to the associates. We don't call them employees, we call them associates. We made 3 commitments at the very beginning. We said that we would, and you have to remember these things from an emotional health perspective, these things are connected. Because you remember, there are people whose spouses were getting laid off. We had people whose kids were coming home. Their parents were in a nursing home and they couldn't touch them. They had friends that lost loved ones. So there's this tremendous milieu of stress. And we said, we're going to do everything we can to keep you financially safe. We're going to keep you clinically safe, and we're going to keep you emotionally safe. And so we committed that we wouldn't lay anybody off and we wouldn't furlough anybody. We're fortunate to have had many, many years at Ohio Health of great stewardship. And so we had the resources where we could make an early commitment that said, listen, even if you're at home, you're going to keep getting a paycheck. Now we redeployed thousands of people. We kept people active in the healthcare system. Even if when the governor shut down elective surgeries, you've got all these nurses that do elective cases. What are you going to do with them? Well, we redeployed them. They became part of the COVID testing program, stuff like that. So we kept them whole financially to try to improve their mental well-being. We tried to make sure that they weren't afraid to go to work, because if you don't have PPE, if you don't have the equipment, if you don't have the training, then you're going to be afraid. You're going to be afraid you take it home to your. We told nurses, we said, listen, at the beginning, because we didn't know a lot about COVID, we said, if you're not comfortable going home to your family after working a shift in the hospital, we will pay for your hotel stay. If you want to stay in a hotel, get a shower, get cleaned up, whatever you got to do, we'll pay for that. So let's make sure they've got the equipment, the tools they need. And then let's really focus on mental health. So we created a resilience team. We have a number of folks that have special training in dealing with stress and the long-term sequela of stress. It's almost like people that, how do you look for PTSD? And I told the team, again, coming from the military, nobody wants to come back from a stressful situation to have someone kill themselves because they had PTSD or they had reached their breaking point. So we focused on those 3 things. How do we wrap ourselves around them emotionally, give them what they need? I mean, right now we're giving people extra money to take vacation because we are. We told a significant number of our associates, I want you to take a week off. I'll give you an extra $250 on top of your pay just to take a week off and go home. Because they have this tremendous loyalty to the institution, so they don't want to go home. And then it affects your mental well-being. So we thought by doing those 3 things, we could try to do the best we could to keep people emotionally well.
Unbelievable. Incredible, because it's kind of like, we started off with people knew that you were there for them. They weren't on their own. So I want to dive in a little deeper into the mental health aspect, maybe a little outside COVID, but still in the arena of mental health. As a physician, as an experienced physician, do you how much do you buy into the mind-body relationship? A couple of years ago, an individual named Dr. John Sarno passed, and he was very famous for associating back pain with mental stress, and it was even extended beyond that. Some people find that a little too extreme, but at the same time, I think everyone does see some sort of connection. What's your understanding on that?
Well, I remember I said a little bit ago, I was trained as a family physician, and that's an integral part of our training. There is a very strong correlation between physical well-being, mental well-being, and a key tenet of that is recognizing that we're all not wired the same. My breaking point, I've been through different training and different life experiences than the person sitting next to me and the person sitting next to them. You have to acknowledge that we all handle stress differently. We all react differently. We all have different stress relievers. I mean, for some it's exercise, for some it's just being with family. We're all different, but if it's well documented that if you don't have good mental health, you will not be as resilient in order to do the things you need to do in life. And then remember, we're in a business where nurses have to be careful with medicines, physicians have to be skilled in the operating room, radiologists have to be on their toes to read the images. If your mind is elsewhere, if you're focused on other things, it becomes a safety and a quality issue in our world. I mean, no different than the airlines. I want the guy flying my airplane to have had a good night's sleep, not have fought with his wife, and not be thinking about his mortgage. I want everybody with a clear head when we're doing things that are high risk, and healthcare is right up there.
Excellent. Okay, so now back to COVID. I want to get to maybe a little bit of the brighter spots, and that's obviously the vaccine.
Sure.
How surprised were you with this vaccine, both in efficacy and speed?
Well, let me talk about speed first. If you think about the fact, I mean, in pretty much 11 months, 11, 12 months, 13 months, we've got a vaccine. And here we are in end of May with half the United States vaccinated. I mean, and this is one of the things I talked about in one of my videos to the associates. When this country decides to do something, it can do it. If it puts the resources and the will behind it, it gets things done. So I couldn't be prouder of the folks that are, whether it was the CDC or the manufacturers or the researchers, tremendous effort under tremendous pressure in sort of an environment where it was a no-fail. Can you imagine, the pressure of trying to make this work and do it safely? So very complimentary. The efficacy so far seems very, very good. I strongly encourage everyone that I meet to get vaccinated. It is well worth it. It is well worth it. So remember that the vaccine does not prevent you from getting COVID necessarily. The vaccine was designed to keep you from being hospitalized and dying. So that's not to say that if you'll sometimes you hear on the news that somebody got vaccinated, some sports figure got vaccinated and then they got COVID. Well, it's still theoretically possible. But remember, at the time this was all theorized, the hospitals were overwhelmed. And you look at what's happening in India today, you can see what people were trying to avoid here was a mass casualty environment. So I'm very happy with the efficacy. I think it's great that they've expanded the indications to children, and I think what we need to track now is what's the long term. Are we going to need boosters in the fall, or what's the next phase of this for us?
I like that. So, until now, I was always thinking that this vaccine was maybe the greatest miracle of my lifetime. But you're kind of taking a little bit of a different approach. No, when you put your mind to something, you'd be impressed, especially this country, right, collectively, what we could accomplish. So,
well, and even beyond this country, I mean, this was done. I mean, this was a multinational effort. So if you think about it from a societal perspective, this is a huge thing. But I will tell you, the vaccine, in my experience as an adult or a leader, this vaccine created more challenges and more ethical issues and institutional challenges than I think a lot of folks know about. I mean, it was, people across the country were terrified of COVID, and rightly so. I mean, my wife would take it. My wife was taking Clorox and wiping off the cans of soup when they came from the grocery store. Once the vaccine was here, remember, this is a vaccine that's owned by the federal government, distributed by the state government, and the healthcare system was empowered to administer it on behalf of the state and the feds. And all of a sudden, you get into all kinds of issues around who goes first, or what happens if somebody doesn't want this vaccine but they want that vaccine, or how do you handle folks that want to fly up from Florida to Ohio to get it? Because every state was doing it differently. And so there were advantages in going to one state versus another. And it created some challenges that between our ethicists and our legal team and our clinical team, we really had to work hard to deal with.
So I guess as a ending question, and then if we have time, you'll let me know if we can open it up. But are there any lessons, as we turn the corner? We're not going to be done forever, but, thankfully we've made incredible progress. Are there any lessons from COVID that you think we should, remember for the rest of our lifetime, even outside the COVID-19 virus?
And this would be opinion. So this is Steve's opinion. Okay. I'll give you a couple. First, and I think Fauci probably said this, we need to follow the science. When this became a very emotional thing. It became a left wing, I don't want to get political, but it became a left wing, right wing. It became a conspiracy, non-conspiracy. In the world we live in today, I hope people can follow the science and follow the math and follow the work and pay attention to that. I think leadership matters. I think what our leaders do and say is very important. I'm not talking about who did it right or who did it wrong. All I'm saying is every time a leader has an opportunity to talk about a topic that is of this level of relevance, everything they say matters. And I think we need to take that into account, because you could be a teacher in school. What you say matters when it comes to things like this, because this is the first time in my experience. I mean, I've done some crazy things, but from a societal perspective, we needed everyone rowing together to fight this. And I think we got 60% of the people. I mean, to date, in every population that's been looked at, we only get 60% of the people raising their hands to get the vaccine. Even in my own institution, only 60% of the people got the vaccine. We don't mandate, for a lot of reasons, we don't mandate vaccination. So clearly people are going to be divided on this. And so how you lead, how you talk about it, how you talk about the science is important, because in the end, there are societal repercussions. And people need this. This was an interesting time, because it's one of the first times in my experience I really saw people sometimes, in some cases, not looking out for their fellow human being. It wasn't about whether you get COVID. It was about, if you're in the elevator and you sneeze, do I get COVID? And so help me out by putting a mask on, So those are some of my thoughts at a high level.
Yeah, sure. And that goes way beyond COVID. What leaders, how they lead by example. Of course, that's everyday life. And I always like to say to people, they should see themselves as a leader, because if you're a parent of your children, you're leading your children. If you're a teacher to your to your students, and if you're a fellow shul or whatever it is that your synagogue that you're at, people are looking at you, whether it's in front or behind. So everyone has some place where they lead. So it does matter. Do we have time for one or two questions?
Well, I'm here at your service, whatever you like.
Okay, I'll take you on I could be here all night, by the way. I have more questions that I didn't get to, but in the interest of time, I do see Nora jumping up and down. So Nora, please go ahead.
Well, since we have all these doctors here, I was just wondering, my daughter has COVID. She's fine. She just doesn't have her sense of smell and taste. But, we're in the house together, and should I be isolating from her? I've been vaccinated, but when you said, it doesn't prevent you from getting COVID, I was like, it doesn't? I thought it did.
No, not necessarily. It was really designed to lessen the symptoms. In any given person, it may prevent COVID, but it would lessen the symptoms. Without pulling out my CDC reference for situations where people are vaccinated and one is sick, my best recommendation would probably be maybe not to isolate. Remember at the beginning of COVID, when we isolated, we put people in the basement and we left food at the top of the stairs. I don't think you have to go to that level, as long as you practice good hygiene, good hand washing, not share utensils and cups and things like that, and probably just some physical spacing for 10 days or so until she's essentially asymptomatic. Any of my other colleagues, if there's physicians on the phone, I just don't have the actual Usually when I got a question like that, I go to the reference guide and I look it up because it's pretty well written down. But if you've been vaccinated and she's doing okay, you're probably just to practice the same kinds of things you would do with somebody that had a bad flu.
Okay, so just
Yeah.
space and not like maybe even keeping 6 feet, maybe
Or like I said, don't lock her in the basement, but maybe don't cuddle on the couch.
in the attic. In the attic.
Yeah. If you've been vaccinated, statistically, you should be fine.
Great. Okay.
But what you don't know is who comes to visit that hasn't been vaccinated. That goes back to my earlier comment. Some of the precautions we used were really to protect people that we don't know their status. So she probably shouldn't go out. And if she is, she should probably be wearing a mask most of the time.
She should be wearing her mask most of the time in the house.
Yeah. So she doesn't spread it to any. I don't know if you allow guests or visitors and things like that.
No. We don't have any
Well,
guests or
if there's no one coming in, then you probably don't have a problem.
I mean, we have dogs though. They can get it. Dogs and cats. No.
That I can't speak to. I've read lots of training, but I didn't do any of the vet stuff.
All right. Well, I appreciate that. If any other doctors want to chime in, they're welcome.
Oh, so I see Phil. Where did you want to go next?
I just want to say, Jill and I both did internships at Riverside, and I want to welcome another fellow intern from Riverside. And I remember Ed Bope when family practice all those years.
Yep.
Had a really wonderful residency.
Yep.
And he trained people like you for empathy, for medical care, and seeing the patients as a whole to answer Rabbi Kappenstein's question. And I think you'll agree with that. That was really his viewpoint.
Well, I think for me, because I trained at Riverside, and then I was very fortunate to be offered a job there right after training, and I love the place. I love Riverside. I love Ohio Health. But I remember many a night coming down when I was a young resident, when you were working, when you were in the box, so to speak, reading films, and we'd come down and hit you with questions on what things were. Good to see you.
That's fun. I will say also that I don't think people realize the type of collaboration required to make Ohio Health between physicians, nurses, administration. There are some places where they really are opposed to each other.
Yeah.
And here you have at Ohio Health where a physician becomes a chief administrator. Yeah. And that's not so common. It's often not that case. But in my experience, when I came to Riverside Radiology, I was a 9th radiologist. When I retired, there were over 100 of us. And, I think Steve can tell you about the neuroscience center we built together.
Yep.
It really was radiology, neurology, neurosurgery, administration. But it really takes a remarkable amount of collaboration between people with different backgrounds, lawyers, business people, nurses, physicians, to build Ohio Health. So I'll give you a lot of credit.
Thank you. You said it well. I can't say it better than that.
Great. So when I see someone's camera off, then go on, I think they want to ask a question. Michael, did you, Dr. Michael Blumenfeld, I see you're on. Would you want to ask a question?
Hey.
I will. Hey, Steve, thank you so much for partaking in this. It was great to hear your story over at Ohio State, obviously. Sure. On the other end, where you went to med school. You are a family doc, and one of the things I've noticed, and I think Phil and the older people online, you mentioned the importance of doctor-patient relationship, and I think just like Rabbi Kappenstein with Kollel and the Jewish community, as we try and connect and build community, I think the doctor-patient relationship is such a struggle anymore with laborists and hospitalists and people coming and going, and doctors so transient. Docs will go one place and take a job because whether it's at Kaiser or whatever. And so I think that I've seen, the deterioration of that doctor-patient relationship with, as a longtime OBGYN, it was key to my practice and being in the same place. I've enjoyed some of the same rewards you have, but as in your position now as leadership, is that something that you are able to focus on? And do you think there's any hope to rebuild some of the importance of just that doctor-patient relationship as opposed to us being a commodity and working in the way that many of us have chosen, I guess, to some benefit, lifestyle and sleep and all that. But I think there's some loss of that. I'm old enough. I'm about 62, and I loved Marcus Welby. So I was like, all right, I love Marcus. No, I mean, those are the things that imprinted on you as a kid. And so, I appreciate your comment, and I'm glad you're in a leadership role and that's still part of your, but I'd like to hear your comment on that, because I think it not only affects the medical world, but also, in our Jewish community and how we lose people because we don't have continuity.
Sure. That's a great question. And probably in the healthcare space, one of the most important things we have to deal with, it's been well written. It's very well written about the perceived lack of empathy in the healthcare providers of the current time. I'm not going to say this generation, because probably some of my own generation. From an institutional perspective, I think first and foremost, we talk about it as part of our value system. We try to let people know that excellence and compassion and inclusion, that those are things that are foundational to our institution, and that the values of the institution are not to be tinkered with. We don't just, you don't just come to work here. You have to buy into the system first and foremost. That puts a certain burden on us when we recruit to look for those things, to try to find people that are empathetic and are interested in traditional patient care. So some of that can be a little bit subjective. And then, one of the big things that drives some, I hate to say this, but sometimes you got to follow the money. It is very possible for healthcare systems and any employer, you can create an economic model that actually incents people to not give good care, because the physicians on a gerbil wheel are trying to grind out patients per day, and all of a sudden the care per patient goes down. And so there's a certain amount of burden that administrators like myself have to try to create a system. You have to have an economic system that rewards people for the right things. You have to hire the right talent, and you have to have a value system in the organization that supports doing the right thing. Is it perfect? No. Is it aspirational? Absolutely. And so I think you have to have people in your senior leader roles that are bought into it and can role model it. And especially, when you get into a situation where you have to choose between doing the right thing or doing the cost-effective thing, sometimes you got to make sure you're doing the right things. It can't all be about the volume or the money or the productivity. You got to remember why we're here. It's a tremendous challenge, and it's going to be a challenge that's with us for a long time.
Thank you.
Okay, great. Anyone else like to ask a question? Oh, Ricky, go for it. And please tell Dr. Markovich what position you are in life.
Yeah, so this is also for you. Thank you for the great talk. It was fascinating. And then for also any of the other physicians on the call. So I'm actually going to start medical school in July, which is exciting, especially after this.
Congratulations.
Yeah, thank you so much. And I guess I was wondering if you and anyone else want to chime in, any advice for school or for medicine in general, especially entering in after the year we've had. And thank you again.
Oh, my pleasure. Well, I can defer to some of my colleagues. Hopefully, you should be extremely proud, because I love to talk about this, because there are so few careers that get you are about to enter a phase of your life that is unlike anything anybody else in the world experiences, because you're going to have tremendous opportunities for education and to stretch your mind and to learn. But you're going to see things that you're going to get to do stuff that they make TV shows about. There's a TV show called ER where you're going to get to do that stuff. And you should be very proud of it, but also very excited. But also you need to stay humble. You need to say, hey, you wouldn't be here but for thousands of other people who went before you to create the training environments and the institutions that you're going to get to be part of. So and I just say just enjoy it. Sit back and go, holy cow, this is really cool. And there will come a day There will come a time when you're going to get, maybe it may not be till you're an intern or a resident, but you're going to have a situation where you're going to do something all by yourself. And it's going to be something that other people see on TV, and you're going to say, I did that. And you're going to, you ever watch a guy on a football game score a touchdown and he spikes the ball?
Yeah.
You're going to want to spike the ball. Okay. But it's a long grind. It takes a long time. It's a marathon, not a race. Don't flame out early. Just stick with the program.
Thank you so much.
Sure. Congratulations.
Thank you.
Wow, that was great. Steve, please go ahead. Another Steve.
Hey, Steve.
Yeah. Hi. Anyway, first off, my dad says, I think he knows you as Howard Werman.
Howie Werman?
Yeah. Yeah.
I know Howie. Yep.
Yeah. Okay. Anyways, well, I tried to get him on this call, but he had plans tonight. But so I'll let him know it was very enjoyable. So I'm not in the medical field, but I'm just curious to know from someone in your position who's got the medical side and the CEO and running like it as a business, what do you see as like the biggest opportunity with the healthcare system? You hear about people going bankrupt from healthcare bills. You hear about, all the different, pay disparities between doctors. And I'm curious to know where you see I'm more thinking of it from the business side. What you think opportunities to improve the healthcare system. And
can I open a bottle of wine before I answer that question?
Yeah. Or another Diet Mountain Dew. Yeah.
Probably the greatest challenge. I mean, if you look at the per capita spend of our GDP on healthcare, it outstrips other countries significantly without significantly better quality. The entire country in many ways is trying to get this figured out. How do you create a system that rewards quality, rewards service? You've got so many competing. You've got the cost of drugs, you've got the cost of medical implants, the cost of research, the cost of education. You've got healthcare in rural areas where there's not, you've got a hospital in a rural county where there's not a lot of business. And you might say, well, geez, just close the hospital. But then you've taken an asset out of that community that may in fact be the largest employer in that community. So these challenges are of monumental proportion. And people are working on it. This is a place where industry and the government and the providers like ourselves are going to have to come together to work on it. There have been some very, very smart people that have tried and have given up. I mean, there was a collaborative between, I'm blanking now, but it's, Amazon and some of the other big ones have come together and said, oh, we'll fix healthcare. And then 2 years later, they're saying it's too complicated. We will need some level of government intervention to incent the right behaviors. Unfortunately, today, you live in a world where the more we do, the more we get paid. And that's true at the physician level, that's true at the hospital level. So how do we create a system that continues to give people choice, that incents institutions to give high quality, but at the same time removes the perverse incentives to be wasteful? I don't have an answer. All I can tell you is there are some really, really, really smart people across the country working on it. But I do think it will take a series of incentives led by the government to probably, I'm not saying a single payer system or anything. It's more about incentives to do the right thing. But it's complicated. It's a great question, but I don't have a great answer for you.
Well, thank you. Appreciate it.
Mm-hmm.
Okay. Anyone else? So I have a final question, and it's a little bit of a tough one. And if you want to pass, I won't take any offense. But over the last 12 months or so, or less with COVID, we unfortunately started to see COVID become a little, at least in some circles, become a little political. And you, as someone who's just focused on the healthcare, and I don't care about anything else, office, election, or anything else. It's about, like you said, following the data and science. How did you grapple with some of the pressure, some of the, voices coming out of people that have not gone to medicine, yet they're in a position to make decisions that have healthcare ramifications. How did you deal with that?
I I think my best answer would be to lead with your values. Would be to say, listen, we're going to be in as the young woman I was telling who's going to medical school, where I said you're going to be in a position sometimes to do things where you're alone, and sometimes you're going to have to make decisions that you don't have great guidance, or the government hasn't given you a rule, or maybe even the rule doesn't make sense. I think when you and I talked, I gave you the example of and many people may or may not have heard of this. When we first got the vaccine and there were 5 or 6 doses in a bottle, you would draw them up into syringes. What do you do when only four patients shows up? You have 2 vaccines left over. The guidance from the government was to waste it. And we're looking at each other saying, why in the world would I not stick it in any arm that I can find who wants it? And so sometimes you have to make hard decisions that are based on your values. And we were one of the, I mean, we had these conversations, and I'm looking at my general counsel as I says, you know, we took some risk by saying, listen, we're not going to waste a dose of this. This is liquid gold, and the right thing to do for society is to use it. Even though maybe the person we're giving it to wasn't a first responder or wasn't a category 1A, you know, I was looking for shoulders, not birth certificates, so to speak. So I guess my answer to your question is when things are really, really hard and the operating environment is unclear and there is gray, go to your values, make a decision, and support the people around you who are doing the same thing you are.
So that will be a great takeaway for all of us. Lead with values. Just go with what you know to be right, what may not be rewarding in the moment, but what's the value? I love that. That's great. Lead with values. That's the hashtag for tonight. So, Dr. Markovich, this was incredible. We could all give a nice little round of applause if you can. This was, you might be setting the record for the longest one. And we still got the same number of participants from beginning to end. So thank you. I hope that, I don't know what your comfort level is, but if we could introduce you to our organization and community here in Bexley and in Columbus, would love to get to know you more. And I could see the passion for people and for helping people. So this was a real privilege for us to have you part of our program. So thank you.
I enjoyed it. Thank you.
2 quick announcements. We may be going on a little bit of a Parsha Buzz hiatus, as God willing, June is going to be a little bit of a busy month for our family. God willing, we're expecting in June. So we might be going on a little bit of a hiatus in the month, but we will be back. You're not finished with me just yet. But we have some great speakers that committed, just not to a date yet. So stay tuned. And the last thing is, for all those who have not heard yet, we have a virtual and in-person and virtual track, depending on everyone's comfort level, program. It's our annual Jewish Learning Celebration, our 5th annual learning celebration. We're going to be featuring NBA All-Star Amari Stoudemire, who we actually just recorded him yesterday. And he was great. So if you can make it to that, or either in person or virtual, that'll be great. It's Monday, June 7th, Capital University front lawn. Plenty of space for everyone to make themselves comfortable. And of course, we'll have a live stream if someone's not vaccinated or they're still just not comfortable. We want everyone to do it at their level. So it's going to be a great night, great food, music. Can't give all the details yet about music, especially if they're not finalized, but we're going to have some musicians and we're going to have some incredible, we have Baruch Levine coming to sing, and we have 100 children that we're going to be highlighting that participate in this. So it's going to be a great event. That's Monday, June 7th. And God willing, maybe July, August or so, we'll be back on. We got some good speakers coming up, and thank you to such an amazing audience for all those who joined us and for those who asked questions. This was incredible. One of my favorites. And of course, this will be on our YouTube channel, at the Kolos YouTube channel, for those who want to view, watch it again, or share with any friends and family around the world. So thank you, all of you, Dr. Markovich, and our participants. Wishing you all a wonderful rest of your evening, a Shabbat Shalom. Have a wonderful Shabbat and wonderful weekend. and hope to see you back next time. Not sure when, but next time.
Thank you.